All right. Hey, everybody. I'm with my new great best friend in the whole world, Dr. Sherry Young, who lives in Taos, New Mexico. I had the good fortune, my wife and I, to meet Sherry in her home in the beautiful town of Taos. And we were asking her questions because we're very, as you know, I'm very interested in mental health and helping share the message, treatment options, how people can get support and encouragement for mental health. And Sherry has spent her career helping people do just that, specifically with addiction and treatment centers and clinics. And so I asked Sherry to come on and share everything she shared with me, which I think is so helpful for those that might be either grappling with addiction or have someone in their life that is struggling with addiction and the options. Sherry's got a business, and I'm going to ask her in just a second to talk all about that. But she helps pair people that either have are struggling with addiction or have someone they love that is struggling with addiction to the appropriate treatment. And anyway, Sherry, thanks so much for taking the time and sharing your expertise and what the magic you do helping people.
Thanks, Cory. It's a privilege to talk with you about this. And honestly, I consider the work that I do an incredible honor. And I'm so grateful, to have been given an opportunity to do the work that I do.
Well, and it is true. I would call it when you were starting to say that. I was thinking my head was going calling. It's a calling because when you share with us about your experiences and what you do for people, I mean, you really true are helping save lives and help people that are struggling to recover. So, could you tell us a little bit about your background? I say decades of experience. You've been in mental health and specifically addiction treatment clinics and centers for the bulk of your career.
Actually, Cory, that's not quite true.
Okay.
I was a college professor for 10 years and then directed study abroad programs for 3 years after that. So I, in my professional, I had been a stay-at-home mom. I found my way, into the academic community and into that career. And I absolutely love teaching. I have an interdisciplinary doctorate in psychology and literature and was studied under some of the greats, the founders really of depth psychology. And that was, just such an honor. So I was very, very well trained. What's really interesting to me is um, shortly after graduate school, um, my life began to spin out of control with my own issues of addiction. And I had no idea that growing up in an alcoholic family, um, a chaotic environment, you know, um, precipitated all of that, and in some ways contributed to, you know, that that path that I found for a while. And in some ways, my addiction really saved me because it was a survival strategy that helped me mitigate the emotional pain that I still hadn't at that point dealt with from those early childhood experiences. And so it wasn't until my second career that I began, you know, that I found recovery and began that healing journey from from surviving to thriving. Let's just put it that way. And
Mhm.
so during those years that my addiction was out of control, I truly went away from my best self. And I did that, I mean, sort of ironically, by managing my life myself in the best way that I knew how. And mostly that was through escape of multiple forms. I was a true escape artist. And it was just such a relief when I was able to stop all that and begin to put the pieces together and heal those very, very old childhood attachment wounds and early childhood abuses that often inadvertently happen in a home where there's addiction or mental illness. So finding my way into this industry, it was like, I had done the research all my life, both in observing others and in seeing what happened, to me. And so I come to this work with great empathy and with, deep understanding of how this happens. It's not like any kindergartner, when the teacher says, what do you want to be when you grow up, raises their hand and says, I want to be an alcoholic. I want to be a drug addict.
Yep. We
don't choose that. But, life stressors and life situations, and especially in our culture today, it's a management strategy for, all of those stressors. So many people take that route.
Thank you so much for sharing your story. I know when we privately met, you shared your story of addiction and recovery, and it was inspirational and uplifting. And we didn't even talk about that before we got going. And you shared so openly, and I so much appreciate that, because I think it helps end stigmas. It helps empower people to get help. And I appreciate you sharing that part of the story. And I know that's woven into your entire story too, and what you do now.
Right. And I think, Cory, that's an important piece, because it's that empathy and compassion and connection that, even if, and I don't often share my own story, but I think my experience really helps to provide even a hidden connection with the people that I talk with on the phone, and, the people that I help in, finding their way to appropriate clinical fit for treatment. And so I want to make it real clear that, my work really spans, primary mental health and addiction issues. And I think so often that there's been and remains a divide between, the medical community and, the approach to mental illness, and the, addiction and recovery community and their, approaches to healing from addiction. And, and these two worlds have got to come together, because it really is both. And I just do not even see a person anymore who is struggling with addiction that doesn't in some way have at the very minimum comorbidity, and then underlying that trauma, attachment, and family of origin survival strategies.
Okay, these are all words we kind of talked about, and I'm the person that always goes, hold on, what are those? So we said comorbidity and
so
family.
Comorbidity would be basically defined as anxiety, depression, bipolar, OCD. Those are manifestations that are actually, in psychology, behavioral health terms, but they're also descriptors of anybody who's in an addiction. So one of the things we say about an addict is that they have all or nothing thinking. So when we think about all or nothing, we're thinking of the behavioral health categories of manic and depressive. Depressive, nothing. Manic, all.
Yep.
So it spans that spectrum, and it's almost impossible to determine what's primary and what's secondary with those issues until somebody's able to put aside the substances. And then it takes a period of time before we can figure out what's driving what. So the addiction can create symptoms and manifestations that look just like primary mental health issues. The primary mental health issues, what ends up happening if the medications are not right, people end up, self-medicating with drugs or alcohol and, trying to manage, those, disorders themselves.
Now, does that fall under the realm of the dual diagnosis? Like we've
Absolutely.
okay,
Comorbidity, dual diagnosis, basically two different terms mean the same thing.
okay. I've
Yeah.
heard that quite a bit from you, and then others as we've kind of inched into learning more about addiction and addiction treatment. Okay, so that's a great precursor. Can you tell us a little bit about what you do today?
Yeah, so let me lead up to that by saying that 15 years ago, um, uh, well, a few years before 15 years, my life kind of fell apart in sobriety. I've now been sober. It's coming up on 23 years this year.
Congratulations.
And I know it's amazing. It's such a great way to live.
Mm-hmm.
Um, but at around 9 years sober, my professional life fell apart um, in, in some ways, in worse ways than my life had fallen apart in my addiction. And it was, I see it now as such a gift because it really brought me up short, and it required that I look at some of those deeper underlying wounds. Here I was, 9 years sober, didn't even think about alcohol any longer, but I was still carrying some deep hurt inside myself that had not been healed. And so that for me became the time to, really begin to surrender and be willing, to heal those deeper wounds and find what I now refer to as emotional sobriety. So those first 9 years, I had physical sobriety, not so much emotional. So I was still, on that bipolar spectrum, manic, depressive, all or nothing, it's still in some ways managing my life. And those events really brought me to a surrender that invited me to let go of the picture in my head and what my life needed to be. And I was willing to surrender and become open to a different picture. And with that came an enlargement that I never could have imagined. And that was entering into, this industry, behavioral health industry. And I started working for a family-owned treatment center in Texas. And it was a treatment center that treated a broad spectrum of issues, not mental health, but both chemical and process addictions. So process meaning eating disorder, sex addiction, and they also treated professionals. So impaired physicians or psychiatrists or psychologists who really got into trouble with their addiction and where their licensure was in jeopardy. So that was my introduction, and my role was that of a clinical outreach person. And basically I, learned how to come alongside therapists, psychologists, psychiatrists, medical doctors, so that when their patients and clients were struggling with, mental health or addiction issues, I had some solutions and could help them find some resources for healing. I worked for them for almost 4.5 years, and then, worked for a big behavioral health company that actually had 19 treatment centers, both were, treating primary mental health and addiction. And those 8 years that I worked for them was just incredible. So the learning curve was amazing. And I, was wildly successful beyond even, anything that I had ever hoped for. So I I did that until 2 years ago, and the model with that large behavioral health, company shifted, and they began working with predominantly insurance dependent people. And I realized that that the reference that I had, built a trusted network of relationships with, that their clients were predominantly private insurance and private pay. So it was just no longer a fit. And so I said to myself, okay, I've got to do this. I've got to have my own company. And so I'm essentially doing the same thing that I've done for the last 15 years, working for employers now, working with a handful of, privately owned companies, that treat mental health and addiction, the full spectrum. And I'm able to help families actually at no cost to them, find resources for healing.
Yes, which is so, so incredible because, admittedly, when we kind of followed this trail that led to you, our counselor here in Oklahoma City, we had a phone call with you, and you and Kyle have known each other for a while. And to just this whole world that opens up, and I assume that because I didn't grow up in a family with, I'm trying to think as we were kind of talking of addiction, that what would you do? One, if you are struggling with addiction, and second is if you have a loved one that is. And the service that you're doing, connecting what I know, talking to you, you only work with the facilities you believe in that have, life-changing processes and approaches to addiction and mental health. And I think that's so, so powerful because I can't imagine a mom worried about their daughter or son and not knowing what the next step is. So can you talk a little bit about, I know no names, but, some of the common questions and things that your clients come to you asking about or needing?
Right. So, that's a great kind of, segue, Cory. Thank you so much for that. So one of the things I think these 15 years of experience afforded me the opportunity to visit all the major treatment centers in the country, and not just, addiction treatment centers, but also hospitals that were treating mental health, and some of them stabilization for, psychosis, and others, that were doing longer term, treatment of mental health issues. And so my clinical skills have really and been enhanced by these experiences. And so, I think when people come to me, they have no idea where to start. So they come with the problem, and the problem is this themselves or this family member, and typically what brings people, I call it the gift of desperation. But yep. It's where, whatever path the person is on currently, that it's causing problems in, their own personal lives, in relationships with others, in their work life, could even, as I mentioned earlier, jeopardize licensure in some cases. And the truth of the matter is that, nobody wants to be doing that, but the survival mechanism that they've chosen is one that traps them and takes them hostage. So they really can't, get out of that by themselves. And I've watched a lot of people over time, try to do that. I mean, honestly, my last year drinking, I tried to do it myself. And my attitude was don't need you, don't want you. I can figure this out. I'm a researcher. So if I don't have the answers, I can find them. And so what I do with families is I really listen.
By the way, Sherry, I call that superhero syndrome, and I have a bad case of it. thinking I can do everything by myself.
Yeah.
I'm sorry to interrupt you, but you said something so powerful to me in your home in Taos that was it's switching from me to we.
Yeah. So that, I honestly believe that that is the essence of recovery. It's the essence of, healing from mental health. Mental health and addiction isolates us.
Yes.
And it keeps us locked inside those old patterns and those self-referential ways of thinking and dealing with problems. And, it's only when, and this is very hard for, an addict or, a person struggling with mental health to trust another human being enough to say, this isn't working.
Mm-hmm.
And that, well, in the first step of Alcoholics Anonymous, the step says we admitted we were powerless over alcohol and that our lives had become unmanageable. So that we admitted is the most powerful beginning of any healing. So every time I get a phone call from a family member or an individual, who's willing to say, this isn't working for me anymore, or this is a lot of work, to manage, my addiction or my mental health issues, that I see that as a first step. I say you're already on the path.
Yeah.
Just by making this call.
The parallel in the public story I share about my own mental health journey is that same thing, getting to the end of myself, specifically depression and divorce, and going, I can't do this by myself. Like the superhero syndrome quickly wore off because when you get to the end of yourself, you can't do it. And I think that's such a powerful concept in mental health in general, and addiction, of course, but in general, this term of rugged individualists in this country, we're supposed to be strong and do things ourselves when truly it's a we thing. We do life together.
Absolutely. And, and everything in mental health and addiction struggles, wants to keep us from that.
Yep.
Everything says, keep it secret. There's so much shame and stigma, as you mentioned, around those issues. I've got a dog that barks.
Sanders,
you go lie down. Okay.
That's so powerful, Sherry, what you're saying there. I wanted you to continue that because, yes, pulling it to ourselves, keeping it in ourselves, either the problem that or else our ego or whatever it is inside of us going, I need to keep this all by myself, which is a snowball problem in itself.
It is. It grows. And, I mentioned earlier how I had gone away from my authentic self. And, so let me come at that from another direction. So basically, I'm a strong woman, and pull yourself up by your bootstraps was, the way that I lived. And, when the going gets tough, the tough get going. And, so managing whatever is difficult and, to, Brene Brown is just doing a beautiful job in our culture in really celebrating those moments of vulnerability where we're able to say, this is not working for me anymore, or I need help. Those words are so incredibly powerful because those are the words that connect us. We think that we're going to be revered and respected with the superhero, I can handle this syndrome. And all it does is further isolate, separate, and keep us stuck.
And that's part of the reason why I want to keep ringing this bell, talking to good people like yourself, is because I suffered in solitude. I went through this And by the way, that's not a one-time thing. That little superhero syndrome still peeks his head up and goes, no, 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 you got this, Cory. But yet so many people are suffering in solitude.
Exactly.
And when there is help and support out there from treatments, counseling, even people in your life, the story that I might have shared with you in Taos there was my parents didn't even know what was going on in my marriage at the time. And so when I filed for divorce, they had no idea, completely shocked. And they were the first people I called when I was at my worst, my lowest, and didn't know. So there's something there of that either culturally too, I think adds to it where we end up taking it on ourselves and then suffering to a great degree that we don't need to.
Yeah, I totally agree. And, you bring up a good point because I don't just work with companies that, uh, provide like residential treatment. I also work with a spectrum of treatment resources. So even intensives or workshops. Um,
Yes.
I make referrals all the time to local clinicians with whom I have a relationship, um, who, for whom I have, great respect and regard, and know that I've vetted them as, clinically sound resources. And then, in my, spectrum of, client resources, I often refer beyond that scope as well. So,
Mm-hmm.
there are many times that, there's just something that people need that is not going to be a fit for those, amazingly great resources, but it's not right for this particular individual. So helping that person get connected at whatever level of help, they're able and willing to accept.
You laid out for us a scope, a spectrum of services, which was so illuminating to us. And you hit on some of them, intensives, workshops. Those opportunities and options exist. Treatment facilities, and then all the way, I think, to hospitalization you laid out for us,
Yeah.
which corresponds with the name of your business, which I think is so appropriate, by the way. Could you share that? And then also your website address?
Yeah. So when I was starting my business, I said to myself, so what is it you really do? And of course, I've been doing this for 15 years. And I answered my question and I said, I find the right fit for people. So I named my business Right Fit Consulting. And the name of my website is rightfitnow.com.
Yes. Which, by the way, happens to be a WordPress website that I'm helping you
Yes.
with a little bit, brushing off some of my website skills. So rightfitnow.com is where you can get a hold of Sherry, by the way, and we'll put those in the show notes, of course. But I think it's so appropriate because what you just said is, by the way, there's something I don't want anybody that would listen to this to overlook. As you say, for your clients, it's a free service that you connect them to your partner networks, that you have a spectrum of treatment, workshops, intensives, all that spectrum of uh, um, options that you can find the right fit for someone.
That's right. So,
Okay, go
so
ahead.
Cory, so my services to individuals and family members and to my referents that I work with hand in hand are at no cost. And the reason that I'm able to and privileged to do that and to offer those services is because of these amazing client companies that I work with who do not pay me for admissions. They pay me a monthly consulting fee that gives me the latitude to do the work that I do clinically and basically offer these services at no cost to people.
Which I think is incredible. And you have very high and backed opinions on who you send people to. And I so much appreciate that because you want to find that right fit. Okay, so let's circle back to, okay, so someone calls and they're some of the questions or problems, they don't know where to start. That's the one that really occurred to me. You illuminated so much of, I wouldn't even know where to help
Right.
someone. Um,
So, people will call and I get their name. I'm usually taking notes when someone talks with me, because I talk with a lot of people, and it's really important to keep things straight. So I start by, asking them who, gave them my name and number, because being able to thank reference and also send, people to my reference is really important to me. So I asked them who, how they got my name and number. And then I asked them to tell me a little bit about themselves, and I get their name and number. And I say, so who are we talking about today? And, then they tell me that, and I write down that name. And it might be one and the same. It might be that they're calling about themselves. And that is such a courageous call. And whether it's, themselves that they're calling about or a family member, I acknowledge that, because they're reaching out. They don't know me, never met me, they're going on the word of a clinician or somebody that they got my name from, and so that's a huge step of, courage for them to take.
Absolutely.
And then I just say, so tell me what's going on. And, that is a really critical point, because, they may have, stacks of medical records, of treatment experiences, of diagnostics, of, I just can't tell you how much many people have been through by the time, I receive the call. But I say to them, so tell me what you're seeing. And so we come at the conversation from a phenomenological level. I want them to tell me, what's your experience of this person? How have you noticed the progression or the development? When did this start? Can you remember any precipitating events? What was the childhood like? And just getting them to start thinking about all of the contributors to this. And, early on, I let people know, that, this happens across socioeconomic lines, across cultural lines, gender, race, it doesn't matter. Addiction and mental health are not respecters of persons.
Yep.
And so, you didn't choose this. This is what's happening. And, and there is help and there is healing. So once we get clear on what's really been going on, what they've done to mitigate, some of the challenges, and what they, want to do moving forward, then we begin to build a framework. And I, tell them very early on, look, finding the right fit is a process. So we're not going to have this one conversation, and I'm not going to have a cookie cutter answer for you. I may have some suggestions by the end of this phone call, and we may have a starting point, but what we're going to do together is explore the options and, find what is really, truly the right fit for you or for your loved one.
Which I think, by the way, is true of finding a counselor. So many times I've shared that I have a counselor. You happen to know him, but that I have now. We've been together for so long that I can text him and we can get an appointment. I said, but we found the right fit with him.
Yes.
And now Lindsay and
it
I.
occurs at all levels. Like even when people call me, like, and they, their addiction issue, has, begun to be resolved, and they're, looking for a sponsor. So they might ask me, what do I look for in a sponsor? And, I can tell them that, so when they go into meetings, what are they listening for? And it's sort of like, all of us, make mistakes, and we don't know what we don't know. Right. And so when I first got sober, I chose my sponsor by the, whether or not she was wearing cute shoes. I quickly learned that wasn't necessarily the best qualification.
That's good. So, okay, it's one starter conversation that probably is multiple conversations until you find the right options that fit the person that
Yeah.
needs treatment.
Yeah. And I mean, this doesn't go on forever, but,
Yeah.
Usually by the end of that first conversation, I can give them one or two names of companies or individuals that I think might, be right for them. And then what I want them to do is go to the website and look. And I say, when you go to this website, this is what I want you to start with. I want you to look at their staff. I want you to look at their daily schedules. And then of course, ultimately it's going to come down to location, travel, distance, financial considerations, whether or not they work with, in or out of network insurance. So all of those, specific logistics that are all a part of the decision-making process. But I always start with what's clinically the best. And then I say, let's start with the best. And if that doesn't work out for one reason or another, then let's work backward, because you will begin to know what great treatment looks like. And, we, may be able to replicate that, taking into consider some of the other logistics.
Yep. Okay. So next questions. I love being able to pepper you with questions because you have so many good, enlightening answers.
And
okay.
What's so great about that, Cory, is that these answers aren't just, head answers or information that I've stored away. These are lived answers. And so, I can speak with you openly and freely, not knowing what question you're going to ask next, because I've lived this for so long.
Yeah, they're heart answers.
They're
and that's
hard
very,
answers.
very apparent talking to you. Okay, so let's say I'm listening to this today and go, I'm either have someone that I think might be in some of these categories. It might be right before I need to make the call. What are the signs maybe for someone that listening and going, okay, do I have a problem? Second, for the family member, loved one that sees someone struggling with an addiction, what are some of the things to look for, to think about?
So typically when things fall apart, that's an opening. As long as a person is rigidly clinging to solutions that have allowed the person to manage an out of control life, right?
Yep.
They are not open to change, and they can't hear people talk about that. So if a family member calls me about someone else in the family, I ask them always the question, is your son or daughter, willing to get help? And, it's really hard when they're not.
Yeah. That's got to be a heartbreaking question to ask.
It is so heartbreaking. And I tell you, I have had so many really difficult conversations with parents where, they've got a 21-year-old, living in their basement, paying the bills and basically allowing them to use in the house and, not work and be fully supported. And, I have to have a tough conversation about, their part in that and, enabling that dysfunction to continue. So those are really hard conversations. And hopefully I've been able to do those with people in a very loving way. Sometimes, people will, get the son or daughter out of the house and change all the locks on their doors And that is a moment of awakening. We hope that becomes a moment of awakening for that individual. And, that the parent is, very clear that anytime they're willing, to accept help, they're there and in full support, that they're not going to continue to support the problem.
As a parent myself, that's got to be a hard, I just can't, I don't want to imagine it. It's got,
Yeah. So there, there's that. And then, if someone is willing, to get help, that, I mean, those are the, really beautiful calls where you get to engage them and, really assure them that, this journey is transformational. When I first started exploring the possibility of, getting sober and, becoming abstinent from my addiction, I didn't realize that it was going to be so drastic. And I thought, I was going to learn how to drink like a lady. And I did learn that. And the only way that I can drink like a lady is not to drink alcohol. So, you never know when you start this journey where it's ultimately going to lead. And then, learning how to drink like a lady other than alcohol, right? I learned how to heal and transform all of those early childhood wounds and hurts and, really get free of all of the drivers of my addictive thinking and behavior.
Yeah. So,
and it's still a process. It continues to this day.
I think every time you share your story, you're answering one of my question, which is speaking to a person that is struggling with an addiction right now, or in that process, you said it was a slow thing for you where you finally got to the abstinence where you can say 23 years later,
Right.
What would you say to the person that is, still leaning on that coping mechanism?
Right.
What would you say to that person?
So I would say that it works until it doesn't work any longer. When my last year of drinking was horrible. I had 6 car accidents, and every car accident I was able to get the car repaired and pay for the higher, auto insurance rates. And I had a certain arrogance and pride around all of that, so I was managing my life. And, as I mentioned earlier, the first step of Alcoholics Anonymous is we admitted we were powerless over alcohol and our lives had become unmanageable. And I was real clear about the powerless piece, right? But my attitude was my life is still manageably unmanageable. I was a bootstraps gal. I was, I knew how to get tough about this and how to manage it. But it was a lot of work. And ultimately, Cory, it was not those consequences that got my attention. It was, what we call the incomprehensible, what is it? It was that inside sense that I would look in the mirror and I would not recognize myself because I'd gone so far away from my values and my authenticity and who I was as a person. So really all I was doing was managing my life. And it was a lot of work. And for me, it was an incredible relief the moment that I said, I can't do this anymore. And, and that was just the beginning. I had no idea what else I was saying yes to in that moment.
Yeah. Did you say that to yourself? Did you say it to someone else, a loved one?
Yeah, no, I said it to myself. And, and for me, the mirror is a huge thing. So I look in the mirror a lot and I look at myself and I say, who are you? I mean, I had really departed from, those really strong values. And I had become self-absorbed. I had become, so busy. And, at the time that I got sober, I was working 3 jobs, thinking that if I was busier, maybe I wouldn't drink as much as I was drinking.
Mm-hmm.
And it actually worked the opposite. So if I had less time, I drank more in a shorter period of time.
Mm.
And, it was really awful. I wasn't eating at that point and just drinking and working these 3 jobs. So
Yeah.
you can imagine that I wasn't operating fully.
Yeah. I think a couple concepts going back to it, the me to we,
Yeah.
um, and that you have the way to say it, but is that solutions that are working until they don't,
Yeah. Yeah.
and
So, it's interesting. So, I couldn't see alcohol as a problem because for me, it had become the solution. It was the way that I dealt with the emotional and spiritual pain,
Mhm.
in my life. And it wasn't until I was willing to say that, that was a problem. And then, there are many paths to getting sober and getting, free from mental health issues. So I just want to say that for me, 12 step, Alcoholics Anonymous was my path. It's not the only path, that I follow today, but it certainly was a point of entry. And I'm so grateful for that because of the clarity that it provided. And, I was in a fellowship of men and women, who had, the same or similar problems to myself. And so when other people would talk, even though I was the college professor rolling my eyes going, oh my God, what am I doing, in this room?
Yeah.
I was hearing other people tell my story.
So I think there's a couple concepts I want to hit on because they resonate in my life, but um, the options beyond just AA, I think that's an important message to share. We talked about previously. There are some other options. Could you list a couple of those options too?
Yeah, so there is a group called Rational Recovery or Smart Recovery. This is particularly appropriate for people who have experienced religious abuse and are having a hard time with the idea of God, even though 12-step programs are very open about that, and they invite people to begin with the God of their understanding, which can even include a God that doesn't exist.
Yeah.
And
Yeah.
I love that. I
Yeah.
love that, or people come in and they, when they're invited to, you know, um, you know, uh, claim a God of their understanding, and they can't do that for one reason or another, people will say, well, why don't you just use the group as the God of your understanding? So this group will provide you good, orderly direction, GOD.
That's good.
Yeah,
Um,
and it's something as simple as that. And then there's a Buddhist recovery called Refuge Recovery, and that's a path. People in Christian circles, there's Celebrate Recovery,
yep.
and they basically follow 12 steps. There are people who find paths through yoga and meditation and a more Eastern approach. um, you know, there are many paths. And I think what's important is not, what's the right path, but, you know, you know, what path can I begin to take these steps?
Yeah.
And once I begin to take steps, I think there's probably some point, you know, in the, the out there in the
Mhm.
distant future
It's-
where
yeah.
all paths meet.
Yeah. Yeah.
And we're all we look back and it's like, oh, we were all on the same path. They would just,
Yes.
different names.
I think that's such a good message, though, to say that there's lots of options. And then, we're all in the same boat in this world,
We are.
ultimately.
We are. It's, we're connected. We're absolutely connected. And, I love it when people tell me about, their spiritual journey, whatever that is, whether that's, to a modicum of, mental health, or, to, addiction recovery, or, just their life path, their journey.
Yeah.
Um, it's so interesting to watch how the steps evolve.
Yes, absolutely. Okay, there's so much here, but I got a couple of couple of questions that I
Okay.
want to, and then I know you're busy, and I want to make good use of your time. But so what really resonates with me about AA all for years has been two things: the role of group, that you have a group that you. AA is so fascinating to me that you can, in every city, major city for sure, find a group to go. And the concept of doing life together, the me to we,
Right.
I live by the African proverb, or I try to. If you want to go fast, go alone. If you want to go far, go together.
Yeah.
And so I've got the word together in my office here hanging because I want to be reminded of it every single day. And it's a resonating theme for my life. What I think is so powerful for AA that the rest of the world I want to get is the power of group. Having people that are in the same boat, on the same or similar journey.
Right.
And I think that's such a powerful concept.
It's so powerful. And, so let's just think about what the power of that group is. So whether it's a 12-step meeting, or whether it's group therapy, or whether it's a Sunday school class, the power or the essence of what happens in that group is confession. So people are telling the truth, ratting themselves out, coming clean, saying, this is not working for me.
Yep.
And they're hearing one another doing this in a no shame zone, where people are free to tell the truth,
Yep.
to admit to what's really going on. And I believe that once we admit where we are, we can never, ever, ever change until we stand where we are in the problem and see it as a problem.
Yep.
And once that happens, the we admitted shifts everything. We confess, we move forward. And I believe that all of that is a spiritual experience.
So it's ironic that we're talking today, because yesterday I've been with a business group in Oklahoma City here for the last 9 years. We meet every month for 3 hours for 9 years. And once a year we go on an annual retreat. And it's the similar principles that we're meeting. It's confidential, it's trust and respect, but that the essence is to get to the top 5% and the bottom 5%. The areas that we push to go where we don't normally probably wake up wanting to go.
Right.
And so I know I personally shared things in that group that is very similar to this, to the format of a type AA type or any kind of support group. It's been,
Yep.
I've clung to that group because I can be my authentic self, let down the shields, take off the mask, and go, okay, here I am in that no shame, no judgment zone. I think that's so powerful. And that's why I want to come back to the AA. I think it's tragedy, though. There are not very many groups outside of these examples that I have found. And part of my mission is to help people go in groups like this, because I've seen the powerful in my business group, in my forum, what we call forum.
Right.
And then I've heard so much of the power of the AA support groups. Okay, so that's one concept, the groups. The second I think is so much really, really powerful is the aspect of a sponsor, specifically with AA. And I know Smart Recovery and other groups you've mentioned have similar concepts of support group, someone that you can call, lean on, ask for advice, that kind of thing. But the role of sponsor, would you talk about that for a second?
Yeah, so a sponsor is really a mentor or a guide. And in the 12-step community, that is not a therapist. Basically, a sponsor is someone who has worked the steps, who has been on the journey, and has the ability to share their experience, strength, and hope regarding that process or that journey. And I see the steps as a journey. So, basically, really being willing, to do the work. And so, rather than, choosing a sponsor who has cute shoes, choosing a sponsor where when they speak in a meeting, you listen and you say, I want what she has. I want what he has. I want to think like that. Or, wow, how could that person do that?
Yeah.
Whatever they've described, in the meeting.
I love that you said these three aspects because it's such a different, it's a fresh perspective for me to think through because it's applicable not just in AA or for addiction, but also in so many areas of life. Experience, strength, and hope. This
Right.
person has something I want. That mentoring guide is someone that's a few steps ahead.
Right.
But the role that's so interesting to me, because when we talk about groups and we talk about sponsors, to me, it feels like support. No judgment, no shame, but support. And when I've heard talk about addiction is that, are you getting support? And these two elements feel absolutely critical. Whatever label you might put on them is a group of people that are going through a similar, um, you know, trial or tribulation or struggle that you are, and the aspect of a mentor or guide that you can lean on, call, and get some help that has something that you want, which is, hope and strength,
Yeah.
experience.
Absolutely. Throughout classical literature, there were always, the gods and goddesses were always, guides and mentors in Homer's Odyssey. Athena, became a guide to Odysseus, and, she appeared as a male guide named Mentor, which is really where we get, that term, mentorship, or, this is my mentor. And all it is a person who has gone before and taken some steps, before you, and now is willing to take steps alongside you. The mentor never tells you what to do. They basically just are there, support as you make decisions and take steps, guiding and
Yeah.
helping make those course corrections and those adjustments.
I know through coaching, my coaching program at UT Dallas, that, you have the answers. That's the aspect that you have the answers in you. I'm here to support, care, and answer questions.
That's
And
right.
but that um, you
Right.
know
And
direction.
your answers might not be my answers. So,
Exactly.
for me to impose my way on you, seems to me to be a violation. And so it's really, a person who's really open and sees that the path they've walked has been appropriate to them. But there have also been a lot of course corrections on that, right? And
Yeah.
so they're open enough to say, you know, you you're going to figure this out.
Yep. That so one more back to my group with entrepreneurs organization, my forum group. One of our rules is experience over advice. You can, we're asked for advice in specific areas. Of course, with your particular practice, what you do, is I want your advice. But when you're in this kind of mentor, guide, friend model, sharing your experiences that parallel the others is such a powerful concept for me because then I can go, oh, I can put that, take that, listen to that and go, what is appropriate for me? How does that work? And then I feel much more empowered because I feel like taking good stuff, there's no ego. You're trying to tell me to do something, I
Right.
can create the solution from these experiences that I gather. I think that's so incredibly powerful.
Yeah. Me too.
Okay. one last question, and then I want to talk about anything we've missed and ask people and ask you where again people can find you. I'll put it in the show notes, the blog post, all that kind of stuff.
Okay.
Okay, I've heard over and over and over you're in recovery. That when you starts abstinence sobriety, that you're in this concept called recovery. What the heck does that mean?
So, for me, and I'm sure recovery means different things to different people. There are a lot of people out there for whom all it means is just not, drinking or using whatever their drug of choice was. For me, it's so much bigger than that. And so for me, it's reclaiming that authentic self, that self that I was created to be, that person, that individual, that nobody else can be the me that I was created to be except
Mm,
me. And so being willing to step into the fullness of whatever that means and wherever that takes me. Um, that's recovery. It's a reclaiming. It's um, a remembering. So if I'm, if I've been fragmented by and distracted by, what I thought was a solution and a path, then it's about being put back together,
mm.
remember who I am.
Gosh, I love that. I love that. That is a message of hope, by the way. Alcohol, drugs, addiction that really destroys, and being able to reclaim that feels powerful. That feels hopeful.
Yeah.
That's really okay. Thank you for that. And I think that's a good word for a message for others to hear too. But if anything, it's sunk in for me. Okay, Sherry, what have we missed? And anything else you want to share before we wrap it up? You've been so gracious to give us your time and share your expertise and experiences and your story, by the way.
Thank you, Cory. I would just say, that whatever the struggle is, it may be about mental health issues, it may be about, addiction. I would just say that reaching out whenever, we're, feeling isolated, alone, ashamed, scared, reaching out to another human being that, we, you know, think can hear us. Trust
Yeah.
usually with all of those issues is broken, and there's a lot of betrayal, and there's a lot of fear in opening up to another human being. My experience is, and I was one of those people, I didn't trust anybody. Didn't I came to not trust myself, and I certainly didn't trust God. So for me, um, recovery has been a restoration of, the ability to trust and connect, and um, and that has been a very, very gradual and slow process for me because I was
Hmm.
pretty wounded coming in, but
Yeah.
and it's still happening. So I would just say, if there's, anybody that you think that you can reach out to,
Yep.
grab them by the shoulder and say, can we have coffee and a conversation?
So for me, it was the answer to this question. Who are the people when the crap hits the fan, they that run out while the others rush in? So
Right.
the people that are rushing in when the crap hits the fan, for me, were the people that I called first. They were my parents.
Yeah.
They were my brothers
Right.
and their wives. They were
Right.
the ones that rushed into my life.
Right.
And I get that too. There's wounds. We all carry some kind of wounds, however they are, through life. And wow, what such a good word. Okay, Sherry, would you remind us again where those that listen that may have, this may be ringing a bell inside of them, and for someone else or themselves can reach out and contact you?
Of course. Thanks, Cory. So you can reach me on my website at rightfitnow.com. Um, or you can call me. My phone number is 575-779-6062. And I don't keep office hours because neither do crises. So call me.
Gosh. Thank you, Sherry. I hope people will actually give you a call and that can touch base and find that right fit. Thank you so much for sharing, first and foremost, your story of addiction, sobriety, the journey from me to we, and then so many good, helpful resources that people can uh, have light to the darkness and find some hope and next steps.
Awesome. Thank you, Cory.
Thank you, ma'am.
Thank you, everybody. Bye bye.